Hello, am I audible? Can you please write in the chat section if I am audible? Hello Fardeen, can you please say that if I am audible or not? Hello. Good evening. Am I audible? You can write it in the chat section if you can't hear me. Good evening Fardeen, good evening Shwet. Hello. Hello Ramisa, am I audible? Can you please write it in the chat section if I'm audible? Hello, am I audible? Okay, good evening. So before I start, I want you all to know that this has to be a very interactive session. If I'm giving you 1 hour, I want you all to take away something in this 1 hour and learn something. So please interact. We will try whatever questions I am discussing today. I want your concepts to be thorough, and I want you all to know every concept properly, so that any related question also if that comes, you will be able to answer it. So whoever is there, I please request you to send a thumbs up or just send a hi if you can hear me. If my voice is clear, then I can start the class. Okay, so I will be starting my class now. So Mansi, hi. If I ask questions, let's discuss, let's make it more interactive, and let's learn together, so that after the end of 1 hour you're thorough with the topic whatever I'm teaching. So yes, let's start. Okay. I'm sorry, I'm a little unwell. So if you ever go through the NEET MDS 2023 question paper, you will see that a lot of questions were asked from general surgery, general medicine and pharmacology. Okay. And lot of picture based questions were asked from general surgery. Okay. I will be covering the basic sciences part today, and we'll be covering the other dental part on the other day. So okay, so first let's go to the first question. Drug of choice for absence seizure. Okay, so before we discuss what is the drug of choice, let's understand what is absence seizure. Okay, so absence seizure is basically a type of generalized seizure. Okay, as you can see over here, absence seizure. Okay, so in absence seizure, you are doing something and suddenly you start staring into the blank. Okay, you're just staring. Sometimes parents think that the child is daydreaming, or he's just staring into the blank, but actually the child is undergoing an episode of absence seizure. Okay, now this absence seizure occur because there is disturbance, there is neurological disturbance in the thalamocortical region. Okay, now this can be blocked. Okay, this neurological disturbance can be blocked, and its manifestation can be blocked by blocking the calcium channel. And among all these, the only drug that blocks the calcium channel is valproate. Okay, phenytoin and carbamazepine block sodium channels. Okay, phenytoin and carbamazepine block sodium channels, but we want to block calcium channels. Okay, so that's why we are going to use valproate. In fact, if you use phenytoin or carbamazepine, there is a chance that you will actually exacerbate the absence seizure. Okay, so that's why we do not use phenytoin, we do not use carbamazepine. Diazepam, on the other hand, can be used for absence seizure, can be. Okay, it is mainly used for status epilepticus. Okay, diazepam is mainly used for status epilepticus. So the answer, but it is, and it can sometimes be used for absence seizure. But what is the question? The question is drug of choice. So the drug of choice is valproate. So I have also put a list. If you see that the drug of choice for absence seizure is either ethosuximide or sodium valproate. Okay, so you can use both of them. Okay, but in this question the options were valproate. Okay, so we have chosen valproate as the answer. In next year or in any coming years, they might give the option ethosuximide. So both of them are the drug of choice. You need to remember it. Okay, over here I have also given preferred drug for other epileptic types. Okay, so first is like your generalized tonic-clonic seizure. For that we can give sodium valproate, lamotrigine or carbamazepine. Okay, for simple or complex partial seizure we can give carbamazepine, lamotrigine or sodium valproate. For absence seizure also we can give sodium valproate or ethosuximide. For myoclonic seizures, again sodium valproate becomes the drug of choice. For status epilepticus, right now what I said, lorazepam, diazepam, phenytoin, phenobarbital, all these are the drug of choice. Okay, so is that clear? Do you have any doubts so far? Okay, let's move on to the next question. So what is the drug of choice for PSVT? PSVT, what does PSVT stands for? PSVT stands for paroxysmal supraventricular tachycardia. Okay, now what is the meaning of paroxysmal? Paroxysmal means which comes and goes. You might have heard this word while studying about trigeminal neuralgia, that it is a paroxysmal kind of pain. The pain comes, the pain leaves. Okay, supraventricular. So if this is your heart and this is your ventricle, right above the ventricle you have the AV node. Supra, position above the ventricle, AV node. So any disturbance in the AV node causes tachycardia. Okay, so this is known as paroxysmal supraventricular tachycardia, and the drug of choice for PSVT is adenosine. It is a antiarrhythmic drug. Okay, rest are other used for other heart conditions. So I have also made a list for you so that you can learn that what is the drug of choice for all the heart conditions. Okay, because they might not just ask you about PSVT, they might just pick up and give you any question, any heart questions, and ask the drug of choice. Okay, so I will be reading them one by one, and I request you all to make a note of it because it is very important and it is summarized in this. Otherwise, you have to sit and make notes individually and find the drug of choice. Okay. So, as you can see, for paroxysmal supraventricular tachycardia, it is adenosine. For stable angina, it is sublingual nitroglycerine. For unstable angina, it is antiplatelets. For myocardial infarction, it is aspirin, clopidogrel, and thrombolytics. For chronic heart failure, it is ACE inhibitors plus beta blockers. For acute decompensated heart failure, it is loop diuretics like furosemide. For hypertension, it is thiazide diuretics. For hypertension in pregnancy, very important, very commonly asked, methyl dopa. Okay, hypertensive emergency, sodium nitroprusside. For supraventricular arrhythmia, beta blockers or verapamil. Atrial fibrillation, for rate control, we give beta blocker or calcium channel blockers. For atrial fibrillation, we give amiodarone. For ventricular tachycardia, we give amiodarone. For bradycardia, we give atropine. For pericarditis, we give ibuprofen. Carditis means inflammation of the pericardium, so anti-inflammatory drug like ibuprofen. Rheumatic fever, benzathylene, penicillin. Then for prophylaxis, okay, so that you do not face rheumatic fever. But if you are already suffering from it, to solve that, you give aspirin and penicillin. For endocarditis, very important, vancomycin plus gentamicin. For hyperlipidemia, it is statins. Okay, so let's move on to the next question. So, true yeast. So, what is true yeast? Okay, so first let's understand that yeast can be classified into 4 groups. Okay, first is your yeast, then your molds, yeast-like fungi, and dimorphic fungi. Okay, so what is yeast? Yeast comes in round or oval shape. Okay, molds on the other hand, they are branched. Okay, they are branched, and when they are all intertangled, they form what is known as the hyphae. So that is what is molds is. What is yeast-like fungi? Yeast-like fungi is a combination of both this yeast plus hyphae form. Okay, and what is dimorphic fungi? This is very interesting. So basically, in dimorphic fungi, in the soil, it is in the form of hyphae. Okay, and in the host tissue, it is in the form of yeast. So basically, it has 2 kind of morphology. That's why it is known as dimorphic. Okay, it is in 2 kinds of morphology. One is the oval shape, the other one is the hyphae shape. Okay, it is present in the hyphae shape in the soil. It is present in the yeast or oval shape in the host tissue. Okay, so now let's see what are the examples. For yeast, it is Cryptococcus neoformans, which was asked in the question and is very important. What is yeast-like fungi? The option is Candida albicans. What is molds? For molds, there are different examples, but you can remember Aspergillus, which usually comes, or Rhizophus. Okay, for dimorphic fungi, it is Blastomyces. Okay, there are other, Histoplasma is also a kind of dimorphic fungi, but Blastomyces is commonly asked. These are all directly picked up from the book. So, like you can see, there's only one example given in case of yeast, and that is only asked in the question. So, skim through it, you will remember it, and that's what will come in the question. Okay, I want to know if your doubts are clear, if anybody has any doubts so far. Any questions? what have we learned so far? We have learned about anti-epileptic drugs, we have learned about antiarrhythmic drugs, we have learned about yeast. So you can see how diverse the questions come. They pick it up from any topic, but if your concepts are clear, you will be able to answer them. They might ask you about, for example, in anti-epileptic drugs, they might ask you about status epilepticus next time. So sometimes what you are supposed to do when you are studying such topics, just pick up the subheadings. Okay, like if they have asked questions from anti-epileptic drugs, don't just study about your absence seizures. Study about all the kind of seizures, all the kind of anti-epileptic drugs, or the table that I have given. That will also help you a lot, because I have given drug of choice for all this questions that I have given. Over here I have mentioned about all the important or seizure type and the preferred drug. So if you can learn this also, that will also help you a lot. Okay, so I request you to take down the notes, write the preferred drug, so that you will be able to confidently answer it in your exam. Okay, so now I will move on to the next question, and I request you to pay attention, because this is very confusing, and understanding the type of inhibition is very important, and also the examples that I provided, because that will help you a lot. Okay, so what are the type of inhibition reaction? Okay, so let's sorry. So there is competitive, uncompetitive, and non-competitive, and also suicidal inhibition. Okay, these are examples which you have to learn by heart. Okay, examples is something that you have to learn. There is nothing to explain about examples. I can explain you the mechanisms of different kind of inhibition reaction, but examples you have to learn. Okay, so let's start with competitive inhibition. So in competitive inhibition, your enzyme has an active site. Okay, so active site is the place where your substrate comes and sits. Okay, when this substrate comes and sits in your active site of enzyme, that is when the enzyme gets activated, and then the reaction will take place. Okay, so what happens in competitive inhibition? So over here you can see there is only one substrate, but if there is one more substrate, then it becomes a competition. Only one of them can come and sit here. Okay, and that is when the reaction will start. Sometimes there are inhibitors which come and sit. Okay, and they do not allow the reaction to start. It is like competing for the chair in musical chairs. You and your friend are fighting for only one chair, so it's either you or her. Okay, so when you sit there, that is when you will win the game. Similarly, that happens in competitive inhibition. Okay, if your friend wins, you are not winning the competition, so similarly, that is what happens in competitive inhibition. Now what happens in case of uncompetitive inhibition? In case of uncompetitive inhibition, you have active site in your enzyme. Now it will only, so you have already come and sat on the chair. Okay, but your friend will come and sit on the arm of the chair. Okay, so it will only bind to the enzyme when the substrate has already gone and sat on the active site. Okay, in uncompetitive kind of inhibition, there is binding of the other substrate to enzyme substrate combination. Okay, it won't just seem like in competitive it's either of them that goes and sits in the active site. No, in uncompetitive the substrate goes and sits to the enzyme substrate complex. Okay, so there is no competition. No matter what, the substrate is going to go and block the enzyme by sitting on it. What is non-competitive? Non-competitive is when the substrate goes and binds to some other site, which is your allosteric site. Okay, it does not go and sit in the active site. No, not in the active site. It goes and sits in some other region. So that is known as non-competitive inhibition. All of these three are reversible. In suicidal inhibition, the substrate will go and sit on the enzyme and it will create an irreversible reaction. Okay, it won't allow the enzyme to ever allow any other substrate to come and get attached to it. So that's what's known as suicidal. It ends the life of the enzyme there. So it is known as suicidal inhibition. Now we will see different kind of inhibition reaction examples. Okay, so for competitive you can see methotrexate. Okay, for that it competes with DHFR. Okay, for statins it is HMG coacetyl reductase. For sulfonamides it's PABA analogs. In non-competitive it is cyanide. Okay, which competes with cytochrome oxidase. So like we have said that it will go and sit in the analogous site. Okay, same for heavy metals. For it the other substrate is lead or mercury. For uncompetitive it is lithium, which it goes and sits in the substrate enzyme complex. So there the substance is inositol monophosphatase. Okay, sometimes it is mixed. Okay, so that is for alanine. Okay, results in feedback inhibition of pyruvate kinase. In irreversible it is aspirin. Okay, which penicillin and organophosphates. Suicide inhibition, like the one which was given in our question, allopurinol, xanthine. Next time they might give you question on clavulanic acid and beta lactamase. Okay, penicillin basically. Okay, so these are the important and the most essential examples for competitive inhibition. Next, coming to this question, which is very important, and if you read the question very properly, you will be able to understand two things, because over here they have given the description of a disease and they have diagnosed it there. So sometimes through questions also you learn more. Okay, so over here you can see, now whenever you're reading a question, try to look for keywords or words that sounds familiar to you. You know, sometimes few disease have their characteristic feature. Similarly, you have to read the questions and look for keywords. It is very important. Okay, I hope I am clear so far. And if you have any doubts, okay, any doubts, if you are not understanding, it is absolutely fine. You can drop it in the chat section or you can message in our group and let me know. I will solve your doubt and I'll clear it. Okay, if you want some similar questions from these questions, I will help you frame that. We can answer that, and you know, that way your doubts will get cleared and you will understand the topic better. A 7-year-old male child reported to the fever clinic. He had step ladder. Okay, so again now we have got the important symptoms. Step ladder pattern fever, very important. Frequent stomach pain, vomiting for 5 days. Okay, these are all very characteristic features of enteric fever, especially step ladder pattern. Okay, if you see this word, if you have option enteric fever, please take that. Okay, what are the best investigation? Read the question properly, not the best investigation. It is written what is the best investigation that needs to be evaluated immediately. Okay, So let's understand. So your enteric fever is caused by Salmonella typhi or Salmonella paratyphi. Okay. So first, when you get infected of typhoid, okay, because these microorganisms go and get into your bloodstream. Okay, they enter your bloodstream first through your bloodstream. The same thing happens for anything that it reaches other organs through blood only. So Salmonella typhi goes into your bloodstream. From your bloodstream, then it goes and affects your gut, okay, your GI system. So first it affects the blood. From blood, it goes into your GI system, that is your small intestine, large intestine. But from blood to get into the other system, it takes time, because initially it has to face your immune system, so it takes time. So sometimes it takes 2 to 3 days, or sometimes even more. Okay, and that is when you see the GI manifestation. So immediately you cannot find Salmonella typhi or paratyphi in your stool or urine culture. Okay, now for viral test, we look for antibodies. Now this also takes time, because first the microorganism will go into your blood, then your body will make antibodies against it. So this also takes time. This also you cannot see immediately. Immediately only it can be observed in your blood culture. So the answer is blood culture. Okay, have you understood what I have said? It is very, if you read this question, it is so concept based. Because you might just go and take vital, because we always think enteric fever vital test, but no, they have asked the question what is to be evaluated immediately. That's why when you are writing an exam, or when you are going to attempt a NEET or any other kind of competitive exam, you are already nervous. So you try to pick up one keyword and then try to answer it, but you have to read the question properly, because they say that they have given twisted questions. This is how they twist it. It's still simple, it's very concept based, but you need to keep your mind calm and answer accordingly. Okay. So now we know the answer for this question is blood culture. So let's learn about the clinical features of typhoid. This is picked up from Davidson, and that's why we say that you should study from standard books, because everything is so clearly mentioned in the standard books. We just pick it up from there. But now I'm here, I have summarized it for you so that you understand it better and you can answer it. Okay, so in the first week you see fever, headache, myalgia, relative bradycardia, constipation, diarrhea, vomiting in children. End of first week you see rose spots on trunk, splenomegaly, cough, abdominal distension, diarrhea. End of second week you see delirium, complications, then coma, and it can if untreated it can also cause death. It is clearly written there. In the first week, diagnosis may be difficult because in the invasive stage with bacteremia, the symptoms are those of generalized infection without localizing features. Typically, there is leukopenia. Blood culture establishes the diagnosis, and multiple cultures increases the yield. Stool cultures are often positive in the second and third week. Read it properly. Stool cultures are often positive in the second and third week. The Widal test detects antibodies to the O and H antigen, but it is not specific. Okay. Am I clear so far? Ritika, can you hear me? Can you please put it in the chat section, and do you want me to discuss the last question again? Okay, so we will move on to the next question. I want you to interact. I want you to ask me questions. If any doubt, let's solve it. Let's understand it now, and let's make the best use of the time. Okay. Okay. So, Ritika, can you just tell me that what would be the what organism causes? Because just now I discussed that. If you haven't heard it, it's okay. You can also mention that in the chat section. What organism causes enteric fever? If you do not know, just tell no. I will discuss that again. So, do you know which organism causes enteric fever? Okay, it is caused by Salmonella typhi or paratyphi. Okay, okay. Let's move on to the next question. Then we can discuss further. Okay. So the question is: a patient was operated for thyroid disorder. Parameters were normal on monitoring. On the same day, very good, Ritika. Yes, Salmonella typhi causes it. Okay, okay. We will discuss this question. Then we can go back and revise again so that you know. As we are progressing forward, you also learn what I have discussed so far. Okay, so a patient was operated for thyroid disorder. Okay, thyroidectomy, they have mentioned it. Parameters were normal on monitoring. On the same day, around evening, the patient developed pain and swelling over the neck. On exploration of the surgical site, bouts of clots were found. What would have happened to the patient? So, Ritika, I was discussing that whenever you are reading a question, you have to find keywords. So those keywords will hint you for the answer. Okay, sometimes they give you very clear keywords and that hints your answer. So at least tell me 2 keywords in this question which you think gives you the answer straight away. Any 2 keywords, just mention what are the 2 keywords in this question which you feel is taking you towards the answer. Good. One more. I think one word which is very important whenever we are reading types of hemorrhages. One word. Okay, I will also give you a hint. No, it is written which kind of hemorrhage. Okay, so time factor plays a very important role. So this classification is according to time. Okay, so time is very important. So over here, which word denotes the timing of the bleeding? Which is that? You can try. I'm sure you can answer it. Yes, very good, Ritika. Very good. Okay, you have got it. It in here. Okay, over here the most important keyword is on the same day around evening. Okay, the patient developed pain and swelling over the neck. Okay, and you can see, like you had said, that clots are also a very important keyword in this question. Okay, so now let's understand what are the different kinds of hemorrhages. Okay, so this hemorrhages, like I told you, is classified according to time. Okay, reactionary hemorrhage occurs within 24 hours, so on the same day around evening. Okay, primary hemorrhage occurs at that time only. If they had mentioned that they observed bleeding when they were operating, that would be primary hemorrhage. What is secondary hemorrhage? Secondary hemorrhage occurs when it occurs after 1 week or after few days. Okay, it is not immediate, it is not on the same day, it is after a week. That is secondary hemorrhage. On the other hand, malignancy has to be associated with a long-term disease or any sign of tumor. Okay, that is when it causes malignancy. So I have also made a table. Can you see the table? Yes, the answer is reactionary hemorrhage. Can you see the table? Okay, so you can see that in primary hemorrhage it occurs immediately, right? And it is directly trauma to the blood vessels. Okay, like I said, you can see it on the table while operating. Reactionary hemorrhage, on the other hand, occurs within 24 hours. You know, when you're doing extractions or something, you can see it very commonly sometimes. Okay, it happens within 24 hours post surgery. Okay, and like you said, like you very rightly pointed out, it is because of dislodgement of clot. So that was the other keyword. Okay, secondary hemorrhage, 5 to 10 days post surgery, delayed bleeding. Okay, that might be a sign of infection. On the other hand, malignancy related bleeding is usually a tumor that is already present, which erodes and which causes bleeding. Okay, so am I clear so far? Do you have a doubt? Okay, should I move on? Okay, do you want me to discuss this further, or any other doubts you have? Okay, okay. If you have any doubts, you can put it in the chat section. Okay, okay. So the next question. Okay. Okay. A 6-year-old male child had 1 week history of swelling in the extremities around the eyes. His mother observed blood in the urine the child is suffering from. So can you again tell me what are the keywords? Can you tell me what are the keywords again in this? Okay, more. Give me one more keyword that will help you to reach the answer. Yeah, blood in urine, very good. But there is one standout feature which will take you towards the answer. Okay, so over here, the swelling around the eyes is the most important feature. Okay, because swelling near the eyes is a characteristic feature of nephritic syndrome. Okay, if they had mentioned that it is generalized edema or generalized pitting edema, the answer could have been nephrotic syndrome. Okay, but as you can see, there is periorbital edema. Periorbital edema is seen in case of nephritic syndrome. If it is generalized pitting edema, it is seen in case of nephrotic syndrome. And let's come to acute renal failure. Very easy to understand. Your kidneys have failed, so you won't have urine. Urine output will be decreased. So that is the characteristic feature of acute renal failure. In renal calculi, you will have colicky-like pain and also hematuria. So see, like you had said, the keyword is pointed out that blood in the urine. But in renal calculi, you can also see blood in the urine. So that's why you have to see one more word, which is your periorbital edema, which is your present in the nephritic syndrome. If you look at the mnemonic which I have made, you will be able to remember all the characteristic signs and you will be able to answer any other question that will be given to you in the question paper, because these are the characteristic features. So can you see and can you note down, and do you have any doubt from this table? So see, if I give you a question that the child is having high creatinine levels and decreased urinary output, what is the patient suffering from? What would be your answer? High creatinine, decreased urine output. What would be your answer? Yes, very good. Okay. Now tell me, if I ask you the question that the patient has generalized pitting edema and has hyperlipidemia, also there is massive proteinuria, generalized pitting edema and hyperlipidemia, what will be your answer? Very good. Okay, so I guess you have understood this so far, so I can move on to the next question. Okay, so I'll read out the question, and again we will try to find the keywords in this question. Okay, a 32-year-old obese woman had polyphagia, polydipsia, and polyuria. She was on irregular diabetic treatment for 3 months. Her fasting blood sugar was found to be 140 mg per deciliter. Postprandial blood sugar was 240 mg per deciliter. Which of the following investigation would ideally suit the patient's follow-up? So what are the keywords in this question? Give me any 3 keywords. Good. Very good, very good. Okay, one more. Yes, you have given the answer. I am very proud that you have given the answer, but I want you to know why you have missed out one very important word. Okay, so what is that? Okay, it is present in the last sentence. I'm giving you a hint. So, which of the following investigation would ideally suit the patient's follow-up? So, what do you think is the sentence for this question? Which is the keyword? Okay, I'll answer. It is patient's follow-up. So, what does patient's follow-up mean? The patient is already diabetic. So we need to understand how the patient is already diabetic. Okay, we have seen P3, like how you said, we have seen her blood sugar levels, we have also known that she is on diabetic treatment from 3 months. Okay, so we need to understand follow-up of the treatment, whether it's working, not working, what is the status of her blood sugar in the last few months. So the best test, like you had said, is HbA1c for this. Okay, HbA1c. Why? Let's see why the other options are not the right answer. Glucagon levels are checked when you want to detect hypoglycemia or glucagonema. Okay, you check insulin level when you are thinking that the patient might have developed insulin resistance. Okay, you check the glucose tolerance test to make a diagnosis. If they had given all the P3 symptoms, they had not mentioned about the blood sugar levels, they would have asked you what is the best test for the diagnosis. The answer would have been glucose tolerance test. But you want to know what is best for monitoring, what is best to know the reading of the last few months. So the answer naturally becomes HbA1c. Okay, am I clear with this question? Do you have any doubts? Okay. Okay. Now, this is a very interesting question, and I like this question because the answer gives such a direct answer. So again, I'll read the question. You will again tell me what are the keywords. Okay. A 60-year-old male chronic smoker, smoking history of 20 years, had dyspnea, non-productive cough, pursed breathing with tightness of chest, normal wheeze. What is the diagnosis? So tell me what are the keywords in this question. If you give me the most important one. Yes, one. Very good, very good. Pursed lip tight breathing. The other one is chronic smoking. Okay, which makes you arrive at the answer, which is a very direct, that the answer is going to be COPD. Okay, one second. Yes, Ritika, do you have a doubt? Okay, I think that was a glitch. Okay, so I will discuss it. So I'll tell you something. If we would have only read chronic smoker, chronic smoker is also seen in case of bronchogenic carcinoma. Okay, but you do not see pursed lip breathing in case of bronchogenic carcinoma. Okay, interstitial lung disease is usually seen when it is because of some occupational respiratory disorder. Okay, so if anything was mentioned about the occupation, we could have come arrived at the conclusion that it is interstitial lung disease. Asthma is usually the person's allergy history would be mentioned, or it might the patient might be a child, not this old. Okay, and the cough is usually productive. Okay, not non-productive. So we know it's not asthma. Bronchogenic carcinoma, no. Interstitial lung disease, no. So the answer, if we go backwards also, the answer becomes chronic obstructive pulmonary disease. So let's understand what's pursed lip breathing. So what the patient does is, he breathes in through the nose and slowly breathes out through the mouth, so that he could control his breathing better. So that is pursed lip breathing. Okay, so the answer to this question is COPD. So did you understand this? Okay, are you understanding so far? Am I going too slow? You can tell me, there's no issue. Okay, any doubt or anything you want me to tell? Okay, I'll move. Okay, so this is the answer is chronic obstructive pulmonary disease. Okay, so this is the next question, and this is also a very direct question. A 10-year-old female child reported episodes of hypoxia. Her hemoglobin's level were found to be low. So these are both the symptoms of anemia. Okay, so now you might be thinking both the answers could be correct, but they have also provided a picture, and in the picture there is one type of cell which gives you the answer. So can you tell me what is that type of cell and what is the shape of that cell that will determine the answer? Very good, Ritika, very good. The answer, that the shape of the cell that takes you towards the answer is sickle. You can see very clearly in this image that the cells are of sickle cell. Okay, I have taken one more picture so that you can understand, because sickle usually looks like this, right? So this is the answer. Okay, this is a very direct question and you can understand it. Okay, now let's understand myasthenia gravis is an autoimmune disease of the neuromuscular junction caused by antibodies that attack. Okay, so this is a very direct question. They haven't mentioned anything about your they haven't given any extra sentences to confuse you. They have asked a very direct question. But before we get into the concept, I would like to understand, what do you think is the answer? Sorry, there's some glitch. Okay, no, the answer is nicotinic receptor. So let's understand the concept. Okay, it's very interesting. So hear me out. So you know that signals go from one neuron to the other neuron with the help of neurotransmitter, right? So can you name a neurotransmitter? Any neurotransmitter that you know of? Can you answer? Name a neurotransmitter, Ritika. If you don't know, you can say you don't know. Okay, so one more is, okay, yeah, so and one very important one is acetylcholine, like very important neurotransmitter. Okay, so what happens is, when a signal goes from one neuron to the other neuron, acetylcholine, if this is a molecule of acetylcholine, it has to go and sit on the receptor, on the acetylcholine receptor. But there is something known as the acetylcholine receptor antibodies. Okay, so what happens is that this acetylcholine receptor antibodies goes and sits on the receptor and does not allow acetylcholine to go and sit on the receptor. So it's like a post box. Okay, so for you to send a mail, the post box has to be empty, but already if there are some fake mails, fake letters that has occupied it, you cannot send the real letter. Okay, so it is blocked. So that's why there is no conduction of impulse. Okay, so the acetylcholine receptor antibodies goes and blocks the receptors. Okay, also it initiates C4 pathway. So, and you know what does the C4 pathway do? It destroys the receptor, so it is irreversible in nature. Okay, and what happens is that in this myasthenia gravis you will see a generalized weakness in the body. In fact, it is said that if you rest a lot, then you will produce less acetylcholine. Okay, if you produce less acetylcholine, there is less production of acetylcholine receptor antibodies. So when you rest more, you are better. But if you are working more, if you are moving your body more, there is more production of acetylcholine receptor antibodies, and there is a chance of muscular weakness. Okay, so did you understand the concept of myasthenia gravis, or should I explain it again? Okay, so 1 hour is going to get over right now, so I will be stopping here today. I will just tell you few important, you can note it down, you can write down the important topics from each question and you can learn it, so that you know these are the very important areas whenever you are studying for the exam. Okay, Ritika? So the first is anti-epileptic drugs. Okay, note down anti-epileptic drugs. Second is drug of choice for cardiac disorder. Drug of choice for cardiac disorder. Okay, next is yeast. Okay, you need to study the entire topic of yeast, the examples, everything. Okay, after that, inhibition reaction, enzyme inhibition reaction. Learn all the type of, whichever I have mentioned, all the type of inhibition reaction and all the important examples. Also learn about the Km and Vmax value, so that they can also ask you this. Okay, next, enteric fever. Learn everything about enteric fever. Okay, infectious disease on its own is very important, but enteric fever is something you need to learn about and focus more. Okay, next is type of hemorrhage. Then kidney disorders, diagnostic test for diabetes, respiratory disorders and their important clinical features. Anemia and seam. They have given you one histological picture, they might pick up any histological picture and put it. Okay, so histological pictures regarding anemia or blood disorders. Okay, myasthenia gravis. They might even give you this picture and ask you what is the question, what is the answer. Okay. Is it clear so far? Just a second. Okay. Is it clear so far, Ritika? Okay. So I'll be ending the class today. If you want any of the notes, or if you want to give me any feedback or something which I can work on, or you want me to make any other notes on something so that studying becomes easier for you, I will do that. You can drop it here, or you can message it in the group. I will be clearing all the doubts. Just a second, I'll come in back in 1 minute. 1 second. Okay, okay. Sorry. Okay, so I have given you many tables which you have to note down, which is very important, and also the diagrams. Okay, mnemonics for pharma drugs. Okay, I'll make a note of it. Okay. Anything you had difficulty in understanding any of this? Okay, sure. Okay, I will give you one tip on pharmacology, is that you need to revise it many times, because sometimes even when you learn a lot of mnemonic, when you are writing when you are sitting for the exam, you will be able to recall the mnemonic, but you won't be able to remember what is corresponding to it. I think you might have seen memes or jokes on it. So this is also very clear. So you need to every day, I mean, the volatile subjects like pharmacology and biochemistry, just try to sit and learn it for half an hour. Just skim through it. I'm not asking you to read word by word. Just look through the tables, look through it. This will help you a lot, okay? Because it is, these two are very volatile subjects and you have to learn it. Also, you can see many picture based questions come, so you also have to go through the pictures. Okay, look through the pictures through the standard books. They directly pick up from the standard books. In the 2023 question paper, I haven't discussed it yet, but you will see that they have taken pictures directly from the standard book. So prepare it. So I hope you have understood so far, and if you have any doubts, you can always message. If you want any notes that I have, yes, if you have any difficulty, you can always tell me. Okay, should I end the class? Okay, I hope you understood whatever I have taught, and I will be coming back again on next Friday, and I'll be discussing further questions. Thank you so much. But one more thing, I'll give you a homework. I have given you all the topics. I have given you 5 or 6 topics. I want you to frame 2-3 questions. Okay, at least 2 to 3 questions from it. I'm not asking you too many, so that when you prepare questions, you learn better. So do that, and we can discuss it further. Okay, you can also pick up questions from any of the books. We can discuss that also, if it is related to 5 topics that I have taught today. Okay, so that your concepts become crystal clear. Okay, you can put it in the group, in the Telegram group, or wherever. We can discuss it the next day. Okay, and I might ask you questions also from whatever I have taught you today. I might give my own MCQ questions. I might twist it and ask you again. Okay, so be prepared. Thank you for your patient listening.